Good day everyone, my name is Gigelin Velasco from SAS and Quezon City. So now I'm performing inserting a nasal gastric tube. Method of introducing a tube through nose into stomach. The purposes of inserting nasal gastric tube are to feed client with fluids when oral intake is not possible. Second, to dilute and remove consumed poison. 3. To instill ice-cold solution to control gastric bleeding. 4. To prevent stress and operated site by decompressing stomach of secretion and gas. The 5th, to relieve vomiting and distension. The equipments required for. So here's the equipments that we needed. A kidney tray, scissor, adhesive tape. Let's assume that this is a nasal gastric tube, cotton balls, and let's assume that this is a water-soluble lubricant, the sterile gloves, the wipes, and also the stethoscope. Procedure. Check the doctor's order for insertion of nasal gastric tube. This clarifies procedure and type of equipments required. Explain the procedure to the client. Explanation facilitates client cooperation. So, hi ma'am, my name is Gigelin Velasco. I'm your student caregiver for today. So, may I know your name, ma'am?
Jessa Joy,
And when is your birthday?
August 26.
So, ma'am, I'm going to do an inserting nasal gastric tube. Is it okay with you?
Okay.
Thank you. Gather the equipment. Organization provides accurate skill performance. Assess the client's abdomen. Assessment determines presence of bowel sounds and amount of abdominal distension. Perform hand hygiene. Wear disposable gloves if available. Hand hygiene deters the spread of microorganisms, but sterile technique is not needed because the digestive tract is not sterile. Gloves protect from exposure to blood or body fluids. Assess the client to high Fowler position or 45-degree if unable to maintain upright position. Upright position is more natural for swallowing and protects against aspiration if the client should vomit. Check the nostril. Check the nares for patency by asking the client to occlude one nostril, one breath, and breathe normally through the other. Tube passes more easily through the nostril with the largest opening. The nares by using cotton balls. Select the nostril through which air passes more easily. Measure the distance to insert the tube by placing. Measurement ensures that the tube will be long enough to enter the client's stomach. Place the tip of tube at client's nostril, extending to tip of earlobe. Extend it to the tip of siphon process. Mark the tube with a marker pen or a piece of tape. So, let's mark it here. Lubricate the tip of the tube at least 1 to 2 inches with a water-soluble lubricant. Lubricant reduces friction and facilitates passage of the tube into the stomach. Silocaine jelly may not be recommended to use as a lubricant due to the risk of silocaine shock. Water-soluble lubricant will not cause pneumonia if the accidentally enters the lungs. So, let's assume that this is a water-soluble lubricant. So, take a sip. Insert the tube into the nostril while directing the tube downward and backward, following the normal contour of the nasal passage. While inserting the tube reduces irritation and the likelihood of mucosal injury. The client may gag when the tube reaches the pharynx. The gag reflex is stimulated by the tube. Instruct the client to touch his chin to his chest. Encourage him or her to swallow even if no fluids are permitted. Swallowing helps advance the tube, causes the epiglottis to cover the opening of the trachea, and helps to eliminate gagging and coughing. Advance the tube in a downward and a backward direction when the client swallow. So let's assume that we inserting the tube into her nostril. Stop when the client is breathed. If gagging and coughing persist, check placement of the tube with a tongue depressor and flashlight if necessary. Excessive coughing and gagging may occur if the tube has curled in the back of throat. Keep advancing until the marking of the marking tape is reached. Nursing alert. Do not use force. Rotate the tube if it meets resistance. Forcing the procedure and remove the tube if the tube are signs of distress such as gasping, coughing, cyanosis, and the inability to speak or hum. The tube is not in the esophagus if the client shows sign of the distress and is unavailable to speak or hum. While keeping one hand on the tube, verifying the tube's placement in the stomach. Aspiration of a small amount of stomach contents. The tube is in the stomach if its contents can be aspirated. Attach the syringe to the end of the tube and aspirated a small amount of stomach contents. Visualize aspirated content, checking for colors and consistency. So this is our syringe. I don't have a big syringe. Inject a small amount of air, 10 to 15 ml, into the nasogastric tube while you listen with the stethoscope approximately 3 inches about 8 cm below the sternum. If the tube is in the stomach, you will be able to hear the air enter a whooshing sound. If the tube is in the esophagus, injecting the air will be difficult or impossible. In addition, injection of air often causes the client to belch immediately. If the tube is in the larynx, the client usually is unable to speak. Secure the tube with the tape of the client's nose. Be careful not to pull the tube too tightly against the nose. Constant pressure of the tubes against the skin and mucous membrane causes tissue injury. Clamp the end of nasal gastric tube while you bend the tube by fingers not to open. Bending tube prevents the inducing of secretion. So let's assume that this is a clamp. So we put it here in the gowns. Hospital gown. Put off and dispose the gloves. Perform hand hygiene to prevent spread of infection. Replace and properly dispose of equipment to prepare for the next procedure. Record the date and time and the size of the nasal gastric tube, the amount and color of drainage, aspirated and relevant client's reaction. Sign the chart. Documentation provides coordination of care. Report to the senior staff to provide continuity of care.
Thank you. You can